are well enlightened.
Oh, yeah.
Because you don't just say, okay, I brush my teeth, I floss, but are you doing it properly? Follow up with our patients.
Mm-hmm.
And we called on like, oh, I'm not feeling well. Oh, calm down. How are you taking the medication? You said 3 times a day. And I think, how are you taking your medications?
Hey, guess who is here with us today? Good morning, Dr. Chris Elueme. Oh, thank you for being with us.
Thank you very much. You're welcome.
As the MD CEO of Dental the Classique Clinic, I know that this was a dream, and now the dream has come true. You thought when you were growing up that you want to become a dentist, and today it has become a reality. So we want to hear the story behind this, at what age you came to term that you want to become a dentist, and the process, and who were the people that supported you, that guided you through the paths to become who you dreamed to become.
Okay, for starters, I've always wanted to go into medicine because that's all I knew. Because my uncle was a medical student at the time.
Okay.
So he was always coming to the house to visit. And
so the thing is in the house,
so
in the family.
I was always inspired by him. Okay. He was eloquent, he was very bold, very intelligent. And my parents always looked up to him. So whenever he comes, they will sit with him, and I was always in awe, you know. Then when it was time for me to write JAM, and I asked him, so what do I do? How do I go about it? He now told me, okay, I have to be very good with maths, physics, chemistry, and biology, and that I'll apply for medicine. And I said, I want to go to UI. He said, no problem. Wow. Then my parents were insisting I go to Benin, because that's where my uncle was. He wanted somewhere I would be more like a mini home.
What's UI?
University of Ibadan.
Oh, okay.
So I said, okay, no problem. Then he now said, apart from medicine, you can also do dentistry. Yeah. And I said, what's that? He said, well, dentistry is the same thing as medicine. Yeah. I said, oh, really? You just treat teeth, diseases of the teeth and the mouth, so it's just the same thing.
Just the area of specialization.
Of medicine. I said, oh, really? So I'm like, okay, am I going to be a doctor too? But that was actually my focus.
Okay.
I said, yeah, you're going to be a doctor too. It's the same thing. So I enrolled and jammed like what we always say.
Yeah.
Then they said I didn't get to the cutoff. I was like, okay. is there something? He said I had to rewrite the jam or go to another school to get into medicine. And I said, hell no, it has to be Benin. So I'm not going to another school. He said, it's still medicine, but in another school. I said, no, it has to be Benin. I said, well, if it's going to be Benin, then that means you have to be dentistry. I was like, oh, sure.
And you waited.
And I went into dentistry.
That's a good one.
Then initially I was like, okay, I want to change to medicine. Because I felt, and my dad felt, if you're reading dentistry, you're not as intelligent.
Oh.
My dad was very particular. So I'm like, no. So when I got final year, I graduated, and I found out that my certificate read Medical and Dental Council. I was like, really? So
you didn't know that?
I didn't know that. Wow. You know, when you're in school, when you're much younger, you're very naive. You don't even know what's going on. And at the time then, knowledge was not as what you have now, where you can go on Google, find out a lot of things.
True.
There it was word of mouth. Whatever they tell you is what you take.
Believe.
Now, even my daughter, when you tell her something, say no, I have to verify from Google. Mm-hmm. I'm like, I'm your father. I'm telling you, no. I have to go on Google to find
technology.
out.
Yeah.
So we didn't have Google at that time. Mm-hmm. Our parents were on Google. So I didn't know that being a dentist, I'm still a doctor. I'm still going to be treating people. I'm still going to be carrying out surgeries. But you're a dentist. What's that? Is that you're a medical doctor? You are nothing. Now my dad's mentality. So I was like, okay. So when I saw my certificate, I was like, wow, Nigerian Medical and Dental Council. So it's just the same. So why am I stressing myself? So then I went on. I fell in love with the profession. Mm-hmm. You know, someone comes in with pain and the person is going back smiling. You restore broken teeth, you know, different shapes and sizes. People come with dirty mouth, they're going back clean and crispy clean, you know, loving smile, fresh breath. You know, I now realize that it's not asking being a dentist, because you're actually treating the patient as well as the patient's disease. You're doing two things in one. At a time. Because people that come to dental, like I always tell my staff, they are very much aware. They're not coming sickly and no hope, so whatever you do goes. The patients are watching you. You pick up a mirror and they don't understand what you did. They're sorry, what's that? They pick up, and particularly if you're treating children, they say, sorry, what do you want to put in my mouth? So that's where the tell, show, and do come in. You tell them what you want to do. You show them before you do. Okay, I want to examine your mouth. This is what I want to use. Do you mind, please? Can you open your mouth? Children love that. You know, but you just rush them and say, okay, open your mouth, I'm your doctor.
Even adults, because I remember when I came to do my braces with you,
yes.
Same thing, I was asking you, what's that? Everything exactly. I see you holding, exactly. I want to know what it is and what you want to use it to do.
So everyone wants to know. Nobody just wants to be just hauled into the dental chair, like, open your mouth, next. No. People want to know, okay, what are you going to put in my mouth? Sorry, what's that? What are you giving me? We're in the era of enlightenment. Everybody knows everything. Some patients even come with a prescription, like there's one of our experts that came with a prescription and said, okay, this is what my dentist says I need to do. He drew a diagram and said, this is what you need to do. I laughed. I said, okay, I need to take a radiograph first to see what's going on. Then you can tell your dentist. Then you're like, no. I said, well, not to worry. What I'll do is, I'll do the basic thing I need to do, make sure the tooth is healthy. Then you go back to your dentist and finish up what you need to finish. Because I didn't know what exactly, because of the language barrier, I didn't really understand what he was telling me. But from the diagram, I got a clue that there's something that has been done. And with the radiograph and what he told me, I was able to merge, both and carry out my restorative treatment. And he was very happy. He said he called his dentist and his dentist was happy. I was like, oh, wow, that's good. It had been God all the way. And believe me, dentistry is beautiful. It's a beautiful profession. I love being a dentist.
That's good.
When I remember when I was dating my wife, then we go on a date, and
Okay.
sometimes
Yes, I hear.
thinking back, I was like, oh my gosh, please, were you that dry? So
No, you talk about it's your dream.
then one day she had to tell me, can we talk about something else? This is a lady that wants to be wooed, and you're there talking about how you feel this, how this injection was failing, how
Yeah.
this patient was not happy, you wanted to do this, and you're just waiting for the next.
Funny enough, she's involved in it right
Exactly.
now. You were kind of preparing her, but she didn't
That's
know and she
it.
didn't
That's
think
it.
about
That's
it.
it.
See where she is
Well,
right now.
I think that was unconscious because I didn't really know that she never liked anything hospital. In fact, when we were dating, I remember there was one time it was raining and she stood outside the hospital and she said she's not coming in. So my friends had to go and meet her outside with an umbrella and say, please come in. She said, no, I'll rather wait outside here. So they had to tell me, Chris, go and meet her outside. She's not coming in. I said, listen, I'm busy. He said, no, she's not coming in. So I had to go outside to pursue her. Please, it's raining. You have to come in. She doesn't like the sight of blood. She doesn't like the sight of blood. She couldn't stand it. She said she'd rather wait out. The rain will have to stop or somewhere. She had to. Can I get somewhere else for her to go? I'm like, no.
Serious.
So thank God we are together today.
Yeah.
That has been wonderful.
And it's really working well, you see.
Yes, actually.
Yeah. So what are the regular daily oral care? I know that it might sound very funny that I'm asking this question. Okay. But again, I'm asking this question because
you're patient as well.
Yeah, because you see, some people don't understand how important it is for you to know the things to do in order for you to take care of your teeth and your mouth generally. Some people don't even know how to brush properly. They don't know how to use some of the things that you're going to mention. So I believe that we learn every day, every opportunity you have to see people talking about something, especially this mouth, because it's good for you to take advantage of it and just fasten your seatbelt. Listen, because you see, dental issue, it's not something one should joke with. No matter how good looking you are, no matter how beautiful, well-dressed you are, you open your mouth and everybody is kind of closing their noses. I mean, it's kind of a shameful
looking for where to hide.
Yeah, you yourself, you're not going to be happy. So I would appreciate if you can give us some of the basic daily oral care that we all need to abide with on a daily basis.
Oh, thank you very much. It's beautiful because when you say basic, a lot of people don't understand that you actually need your daily basic oral care. You have to just don't brush your mouth and you're off. No. First and foremost, you have to make sure that you brush twice a day. That's number one. And use a good toothbrush. Ensure your bristles of your brush are straight, not flared. Because some people say, I bought this toothbrush in Dubai, and no, it's not where you bought or where you imported or where you manufactured your toothbrush. It's the state of the toothbrush that matters at all times. So the bristles have to be straight.
Oh, really?
Yes.
Wow, I'm just knowing that now.
Well, when it's flared, a lot of people say, hey, it's still brushing. No, it has to be straight. It has to be firm. And also the shape of the head of the brush have to be more or less like pointed.
Okay, doctor, that means when you're using a brush and it starts spreading, you shouldn't continue using it again.
No, even if you bought it yesterday and it starts spreading tomorrow, you don't have to wait for the 3 months.
Just discard it.
Just discard it. Because it's no more effective. Because when it's not straight up, that means it's no more firm. And the integrity of the tips that actually brushes the teeth are no more there. So they're actually meant to go in between the interdental space to brush off, not like when you're going this way. So imagine if it's spread like this. It's just going this way. So when it's firm, it's going and it's straight enough to
remove the debris.
Take out the debris, take out the plaque that actually causes the gum and teeth decay, gum disease, bad breath. So, and secondly, you have to have the culture of flossing. That's another key thing about oral care. You have to make sure you floss daily and properly. A lot of people don't know that when you want to floss, you don't just go in and out, 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 in and out. You're actually meant to go ensure the thread of the floss is rubbing against the tooth.
Oh, that means it's good for you to have the thread rather than having the other. There are different type of floss.
Yes, you can both actually can suffice.
Okay.
When you have the one with a hanger,
okay,
you just press it against each tooth and flick it out.
Oh.
Press it against each tooth and flick it out. Even the threaded one, you snap it in between, just go through the contact, rub it against the tooth like you're rubbing the back of your body when you're trying to talk after you have the bath. Just the same way. You just go up, go up. Okay. If you go down and you do this, you're actually damaging your gum.
Yeah, because I know.
Hurts.
Yeah,
yes.
I know.
Now a lot of people don't know.
That's why I stopped using. That's why I stopped using it, to be honest.
Well, you.
No, I'm learning now. I now know how to use it.
You don't have to stop. That's where the education of the dental floss now comes in. Okay. We in dental with Classique, we ensure that our patients are well enlightened. Oh, yeah. Because you don't just say, okay, I brush my teeth, I floss, but are you doing it properly? That's what we'll ask you. Like the time we had a patient had an extraction done, and we're like, oh, because we do 24-hour follow-up of our patients. And we called and like, I'm not feeling it. Oh, calm down. How are you taking the medication? You said 3 times that. How are you taking your medications? You said 3 times. When did you take it? 9 o'clock, 12 o'clock, and then by 2 o'clock again, and I took it. It's not working. It's not gonna work because the medication says 8 hourly, 12 hourly, 6 hourly. You have to follow it through. If it's 8 hours, you take it for 8 hours. It has to be. If it's 6 hours, it has to be 6 hours. Some people will say, hey, this is what the chemist told me. I'll tell them,
The chemist, it should be your doctor.
I am your dentist.
Yeah.
I treated you. For dental procedures, we have our own prescription. Even the medicals, a lot of them don't even understand our prescription. So sometimes some of my colleagues say, there's this patient I saw, I'm referring to you. I told him to take ibuprofen 2 times a day. That's okay. So that's not okay. It's dental pain you're dealing with. So you have to be precise when you're dealing with dental issues.
Okay. Now, the most common issue is dental pain. What are the things that we need not to do in order to avoid these pains?
Thank you for asking me that question, because a lot of the irony of thing is that I hear a lot of people say, you don't need to take sweets. I Google and I laugh. I tell the kids when they come to the clinic, because when you see me and kids, you think we are age mates, you think we are besties.
Yeah, you're good with kids, really.
Thank you very much. So I tell them, you know what? Tell your mom you need to take your ice cream. You need to take. Mother said, no, doctor, so we should be coming here because you want us to be paying money. I said,
They don't know.
I said, number one, you would help your child to be straightforward with you. If your child knows, oh, I have my sweets, nobody can entice them outside. Like my daughter, I tell my daughter I want to take my child to ShopRite. So she'll like, I go to ShopRite. Oh, I know ShopRite. I've been there before. Or you tell my daughter, come and take sweets. She'll like, there's nothing special because she takes them at home. So I tell them it's the time at which they take them that matters.
Okay.
Saying they should not take them at all because
so
these
what's
days.
The time they should take?
After meal.
Oh. But not at night?
No. If they have to take it at night, then they have to brush immediately afterwards.
For going to bed, okay.
They can wait an hour or so, but rinse their mouth, then brush afterwards. Then secondly, I tell the children that come, I tell my children.
It's okay. They're your children.
I tell them, don't chew your sweets.
Oh.
That's another hack, yes. don't suck on your sweets. I'm a sweet tooth. So
it takes a long time to suck on that sweet. Sometimes you want to chew it.
So
I do
when you
that,
suck
so.
on the sweet, you enjoy it and you don't have to take too much. Then when you rinse your mouth afterwards, the tendency of having cavity is almost zero because you rinse your mouth and you brush twice. But when you say, oh no, don't take sweet, I will not give you sweet, and they go to school because over 95% of what you have in a party pack are sweets, refined carbohydrates. It's not really sweet per se, but they are sweet things, biscuits, cakes, lollipops. There's this one my daughter brought one time. I was like, what is this? I actually thought it was more or less like a biro, and she was chewing it. I'm like, you don't do that. I said, no, that is sweet. I was like, oh, really? And it looked so fanciful and beautiful. I wanted to even take it from her to write. I said, no, it's sweet. I was like, really? Sweet? So you could imagine, so if a child goes to school and is exposed to sweets, so the child would rather take all the sweets in school than rather come home and like, Mom, I don't take sweets. There was a child I treated, I will never forget this scenario. The child had cavities. I was like, oh, mother, when your child, said, before I could even finish, no, don't say that, my children don't take sweets. I'm like, Madam, let me explain to you. No. So his younger brother, was like, Mommy, no, he takes sweets. So he was like, Mommy, no, he takes sweets. So the mother said, what did you say? He takes sweets at school. So the mother was like, what? I don't give you sweets. Why do you take sweets at school? I said, Mother, that's what I'm doing. Let them take sweets at meal times so that you can monitor the number of sweets they've taken. Like my mother always remind me, we have a deal. And I said, yes, we have a deal. The deal is, take your meal. When you are taking your sweets, you don't chew your sweets, you suck on your sweets. By the time she's sucking on one sweet, she has 10 sweets to go. She'll get tired. She'll stop at 1 or 2.
Yeah, that's
true. She's moved on. So the other sweets will be kept for another time. So you're going to reduce the number of refined carbohydrates that you're taking. And also, you're going to help your child develop a sincere culture where the child is open to you. Okay, Mom, they gave me party pack today in school. This is it. Okay. No, this is beautiful. So take your sweets. And the child knows, okay, after meal, I'm taking this. So once I'm done with my homework, that's my daughter's routine. She does have her homework. She takes her food. The next day she takes the sweet from her party pack. And the party pack might even take her for almost 2 weeks because
to finish up
because she's not taking them independently.
Okay.
So my family friends say, how do you do that? I say, they have to take their sweets after meals. Don't tell them no.
At what point are they supposed to use mouthwash? And are they supposed to use mouthwash and the salt with warm water to gargle as children, or is it meant for just adults alone?
Yes, children, because you're not able to monitor them. You're trying to avoid the fact that because they're children, they're very adventurous, you might want to swallow it.
Okay.
Like, how does it taste like? Like I take out
that's
one
for
day
the mouthwash.
For the mouthwash. And I say, I swallowed it. You're like, no, you're not going to. It looks like berry juice. No, it's not berry juice. It's mouthwash. So I have to tell his mom, please. She doesn't know his mouth. I said, just teaching the basic oral hygiene, like I just mentioned earlier.
Okay.
Brushing twice a day, flossing, scrubbing your tongue is another important one. Drinking lots of water.
Yeah, I know about that water.
Yes, it helps. All that are just basic things that once a child inculcates, they wouldn't need to be using the mouthwash.
So the salt with warm water to gargle is out of it also for children?
No, but if you feel they have a bit of bleeding gums, it helps.
Oh.
A teaspoon of salt, half glass of warm water, they squash before going to bed.
Okay.
It's a beautiful one, Sometimes for busy parents who are very, on the road, they don't have the time. You can just take normal saline, that's the drip.
Okay.
You know, put it in their flask and tell them, you know, when you get to school, use it to squash your mouth after eating.
Okay.
You know, that will also help. So even if they swallow it, it's normal saline. It's biocompatible. It is not something that's going to harm them. At least you're rest assured that even if they gulp the whole normal saline, it's not going to hurt them, at least. But you know that the quantity you're going to give them is not too much. And of course, it's something, when they are small flat, like 100 mils or 200 mils, depending on what flask you get them, or even 500 mils. So it's just something that you're scared of, saying, oh, I don't know what she's taking, I don't know whether she drank the mouthwash. So we don't encourage, I don't personally encourage parents to do that. But if you're rest assured that your child, I've seen a 5-year-old and his mom told me he uses mouthwash very well and he spits out after brushing.
Okay, it's very good with it. So that's fine.
Then another thing I also want to add is ensure you use a toothpaste that contains fluoride. Yes. And they have one for kids too. For 0 to 2, 1 to 6, 2 to 5, different manufacturers, different toothpaste companies.
Sometimes I was doing a research and I saw that babies that are a year old, they shouldn't use fluoride. They should use water and just soft brush to wash their mouth. But it seems some parents don't know about that. They use the toddler's toothpaste that has just a little percentage of fluoride in it.
Yes, you use fluoride containing toothpaste when your child already have teeth.
Okay, even if it's just 1 year old.
Even just 1 year old. The fluoride is actually meant to strengthen the teeth and increase the resistance of the tooth to tooth decay. Now, when you start using fluoride containing toothpaste for a toddler without teeth, there's no justification for using that.
Oh, okay.
There are no teeth in the mouth, so what are you using the fluoride?
Okay, another question I'm going to come up with the elderly ones who has no teeth in their mouth again. How do they care for their mouth?
Yes, it's all they need to do is just ensure they rinse their mouth thoroughly and scrub their tongue. Then ensure they're healthy too, because when they have diseases like diabetes, it also goes a long way to compromise the oral cavity and makes the gum and their tongue prone to infection, and also affect the state of the gum itself. So they need to also ensure that they see their position and control their diabetes, one hand, or any other debilitating disease that they have, if they need to stay healthy. And for those that, of course, use dentures, you have denture cleaners, you have denture adhesives that they use and all that also help to maintain the state of the denture and also their oral health. And also they'll teach them on what not to use and not to eat with dentures. Because you can't wear dentures and now start cracking cow
bones. Yeah, that's too strong for
I tell a lot of my patients that you need to understand that once you start using restorative materials and stuff like that, you have to also have in mind that dentistry is developed based on Western diet. They didn't develop dental materials or restorative stuff based on our own diet. They don't chew bones like we do. They don't chew intestines like the shaki, the pomo, and all those stuff.
Yeah.
They don't chew that. They chew soft chicken that you can even eat without teeth. So why do you have to now start thinking that, oh, now I have implants, now I have dentures, then I can now start chewing those stuff? You're going to damage your restorations and the dentures, and you come back to us and we smile to the bank.
There is this problem that can come to man if you don't really take good care of your mouth and your teeth. The lung disease.
Okay.
Stroke,
Okay.
and also heart disease.
Yes.
Is there no way people should be fully aware so that they do these things very quickly as soon as they just have a little sign that they have issues with their teeth?
Yes, thank you for that question. The thing is, thank God for research. We found out that people who have gum disease have been known to be prone to having cardiac diseases, lung disease, like you said, even brain abscesses, because there's the same blood that flows through your body that flows through the mouth. And it's also known that it's easy for bacteria in the mouth because the mouth is considered to be the dirtiest part of the body, even dirtier than the anus. So when I got to know, I was like, how possible?
Because you eat a lot.
No, apart from that, all the microorganisms you have in the mouth, so if you're not controlled, they are known to seed into the blood. That's why when you have gingivitis, one of the first signs, the earliest signs, you start bleeding out. So your blood vessels in the gum are engorged, and they're friable, and they easily rupture and all that. So that's why when you someone can even just say, hey, what's wrong with you? And you start bleeding, you just bleed on slight probing, or even just massaging your gum, you bleed because of your gum disease.
What causes inflammation of the gum?
Plaque bacteria, is not worms, like a lot of my patients come in telling me that somebody told them, and you'll bring evidence, I saw the worms. I'm like, no, it's just deception. The thing is, we all have bacteria in our mouth.
Everybody?
Yes.
So it all depends on how you care.
Yes, the worms in the mouth per se are actually germs, bacteria.
Okay, germs.
Microorganisms. You always have bacteria in your mouth. When a child, the only being on earth that has a sterile mouth is a child that was born less than 10 to 20 minutes ago.
Oh, really?
Yes.
That child that they gave birth to yesterday, you mean, is already starting having a bacteria?
In short, it's known that after 12 hours of birth, the child's mouth is almost fully colonized, because you have them in the air. You have bacteria in the air. So once the child opens its gives an out cry, of course the spores go in and they settle in, and a lot of these oral bacteria are known as commensals because they can stay there and they are comfortable, but they are not harmful until otherwise known. They are known that commensal means that they are just there, but you're not benefiting from them, but they are benefiting from you because you are their host. So you're just there, and their byproduct is actually what affects you, which is acidic.
Okay.
Is known as lactic acid because they secrete lactic acid, and when their population increases, it also causes more damage to the gum. And that's why when you don't brush properly, or when you have poor oral hygiene, the population of these microorganisms in the mouth increases, and the byproduct also increases. Imagine one person is urinating somewhere and you have 1,000 people doing the same thing and not flushing. That's the kind of thing that happens.
Okay. At what point should somebody use crown or braces to correct their teeth?
Yes, that's why you need to see the dentist. When you see your dentist, the dentist will do an assessment and tell you, oh, these and these and these are the things we need to correct. You might need a crown when you have this. What we do in dental the Classique is when our patients come, we tell them, okay, we run an assessment. That's where the consultation comes in. Whilst we do an assessment, we'll hear you and we'll examine. We carry out our investigations. We have to do with x-rays. If you have to do blood work just to verify what we're speculating, not be sure of what we're dealing with, then we'll sit you down and we'll run you through the treatment plan that we have for you. Now, we'll advise you on which one is best for you.
Okay.
But sometimes patients come with their how will I say?
Self-medication.
She'll tell you, oh, this is what I want. No matter what you're trying to tell me, fine, yeah.
But you know they're still going to come back when you give them that one they want and it didn't work. They'll come back to you.
Yes, and that's why we smile, because you're still going to pay. So,
it's to your advantage.
It's
not
our
to their
advantage. So we tell you, just like the spirit and the bride says come, and let him who hears says come. So we tell you, okay, now this is best for you based on this. Now, if you tell us, oh, your budget is okay, we can give you something that fits your budget.
Okay.
So we tell you, this fits your budget, but this is the best for you, but this will fit your budget.
And it's still going to work.
It's still going to work. It might not be exactly what you want. For instance, oh, I want a crown. Oh, okay, you don't have the money for zirconia or Emax or the high-end ceramic crowns. You can say, okay, you can do the bonded porcelain bonded to metal crown. It's not as beautiful, but it's still going to function as a good crown. Or, oh, I don't have, okay, you can do the acrylic crown, knowing that it will not last.
But that can get broken.
Yes, they all have their pros and their cons. So the thing is there for you to make your decision.
Okay.
Oh, this is what I want. So you're not, for us, we are very particular, and we also want to ensure that our patients make informed decision, not decision based on what we want them to. But, oh, I am aware, I know all this, but this is why I'm making this decision. So, oh, you want a crown. Why do you want a crown? From what I see, you don't need a crown. You need to do braces. No, this is what I want. Okay, fine. These are the reasons why we tell you need braces. You arrange your teeth. Naturally, your teeth are healthy, so you don't need to, because when you're going to wear a crown, you have to damage those teeth to be cold, because you have to shave those teeth to wear a crown. You're not just going to wear them like a wig. Okay, I'm wearing a wig. No. You're going to shave, like somebody's asking you to shave even your scalp and your skull to wear a wig, you know. Why do you have to go through that process? Since I have long hair, you know. So we will tell you these and these. The only reason why we can make a crown for you is if that's what you want. But at least you are aware there are other healthier ways to arrange your teeth and to have a perfect smile.
But the crown that is like the human teeth, that one is still good, right?
Yeah, that is a zirconia crown. The Emax, the beautiful.
Okay.
You know, the beautiful. So it depends on what you want, what your budget can afford. So we go.
You do implants and a denture.
Yes, we do implants.
And I think it's when someone's teeth is so bad that it cannot be saved. That's when the person should consider implants or denture.
Yeah.
So how expensive is it, or how cheap? Let me put it that way. Is it cheap or is it
expensive? It's in dollars. It's in dollars. You know? Nigerians speak in dollars.
Oh, really?
It's in dollars. But we all, like I said earlier, and we always ask a patient to come in. You can just tell you over the phone, or you just called and say, okay, I hear you do implants, how much? We need to see, we need to know if you are even a good candidate for an implant. Because if you have poor oral hygiene, the implant will not last.
So you mean somebody can have so much damage in their teeth that it cannot be saved? The implant or denture that would have been the solution cannot fit in?
Yes, because if a person have like gum disease, you know, and you're not apt to taking care of your teeth, you're not you don't see your dentist once in every 6 months, which you're meant to do. That's part of your, although that's not daily anyway, but just once 4 to 6 months, see your dentist. And your dentist will assist you to ensure that you have a healthy oral hygiene. And go on, but when you now say, okay, I want an implant, person is diabetic, uncontrolled diabetes, person always has seizures, uncontrolled seizures. There are a lot of things there are a lot of medical conditions that actually contraindicates you. Some people even react, some people have allergies to metal. So we're going to be using, although the metal we have are inert, but we have also be sure that you don't react to any metal. I've seen a patient that says she reacts to plastic. So, you just need to ensure. So that's where the consultation comes in.
I think I remember when I came for my braces.
Yeah.
Your staff brought the form to fill.
Yes.
And these were the questionnaires that were there for me
Exactly.
to tick.
Exactly.
Well, and I was wondering, why were they asking me that? Now I understand why.
Yes, because we need to understand it. We thank God for evolution of science. So you just have to have these details.
At least with that, you can understand because of chemicals.
The bottom line is you have to understand the patient. You have to understand who you're dealing with. Like I said, you're first dealing with the patient and the chair. Then you're treating also the dental condition. You don't jump in, okay, you need braces, oh, you need implant, oh, you need tooth fillings, oh. That's where the consultation comes in. I had a patient one time that wrote on his form, all these questions are unnecessary. And the nurses were like, no. I said, no, don't worry. We now sat the patient down, and could you believe that he had a medical condition, that he was hypertensive. We checked his blood pressure was through the roof. We had to stretch our dental chair almost in a supine position, and we kept on monitoring his blood pressure. And I said, bros, I thought you said all our questions were relevant.
I'm
sure. He said, no, nothing's wrong. We're not wrong with me. We just routine check. So imagine that kind of a patient. You just took out the tooth. Okay, the tooth is, hey, I'm a dirty tooth. And he comes back bleeding, uncontrolled. Yeah. Then he's having palpitations, his heart.
And then they will now put the blame on you.
That's the doctor. So we ask all the questions. I can even ask you the name of your DNA if there's something like that.
A lot of people go for veneers. Don't you do it here?
We do veneers. Yeah, we do veneers. We do veneers. We do everything dentistry.
Okay.
We do child dental care. We are at home with that. Parents love bringing their children here. The elderly, we see them. Family, we see family. We run a family dental clinic, and we do all dentistry, all surgeries. Apart from major surgery that you have to go to the theater, that will refer. But every other thing that has to do with outpatient dental care is done here.
You are a family dentist, and
yes.
You work in a government hospital,
yes.
And also you own your own dental clinic. How do you cope? How do you manage both together?
It's just the grace of God and the wisdom of God.
Wow.
And I have good support system, like you always talk about.
Your wife, I know.
My wife and my team.
Yeah, they're very good people.
They've been wonderful. And you can go on Google and see we have reviews. They're not doctored anyway, so I'm happy. Yeah. Those are personalized reviews, and they tell you their personal experience.
Wow.
So it's been God all the way and the wisdom of God.
Yeah. So what's your mantra?
Yes, we are grateful to God that we see patients every day, VIP patients, expatriates, and patients who love and appreciate our services. We render quality dental services daily in very large amounts.
What's your pathway to success?
The grace of God.
Wow.
Trusting God, training, building to trainings, going for trainings, training myself. Thank God, trainings are all around us on YouTube. I have mentors as well. So it's just the grace of God, and with all these, that would have been helping me.
You see, what we're talking about is a dream come true. You dreamt to become a dentist. Today you are not just a dentist, you own your own hospital, and you're working in a government hospital as a family dentist. Now, when someone comes to you, what would be your advice for the person?
Yeah, firstly, trust in God, trust in yourself, believe in yourself, study, be humble enough to learn, because you can't just become a dentist. You have to have people who will teach you, and you have to learn from people, irrespective of the cadre, because I also learn from nurses, from technologists. So you have to avail yourself to learning and to be taught by people, and also be prepared and love the profession. Because if you don't love it, no matter what you do, you will not get through. Thank you.
Dr. Chris Nduweme, thank you so much.
Thank you for having me.
Thank you. God bless you.
And you too.